Good morning. My name is Victor Portillo, and I'm the Trauma Medical Director at Medical City Arlington. We're a level 2 trauma center in Arlington, Texas. In my role as a Trauma Medical Director, I think the most important aspect that I play in the care is ensuring that our facility has the appropriate resources, or if not in-house, at least relationships and connections to try to really provide the best care for our patients that may walk through the door. Some of the more common injuries that we tend to see are things like concussions, for one, ligament injuries or sprains, growth plate, like injuries of themselves, fractures, things of that nature. In particular, one that we're seeing more of now is what we term overuse injuries. Yeah, so overuse injuries have kind of exploded, I guess, is the best way to say it, as of late, with the development of these year-round, like, youth sports and leagues. So what that basically means is that when kids are playing, in particular, one sport, year-round, what they're doing is repetitively stressing the same joints and muscle groups. And because they're playing these sports year-round, so think, your kid that's playing club sports as well as for the school, there's really no recovery or rest period. They tend to play almost year-round. And with that repetitive injury pattern for the same exact joints, we end up seeing injuries that we have termed overuse injuries, so to speak. So soreness, pain, is to be expected, especially if your kid is starting like a new sport, or it's like the first week, like kids that are doing the two-a-days after being off for summer, or starting like soccer after being off for a while. It's normal that they're going to have some soreness or discomfort. What we tend to see with that is pain, or discomfort rather, not pain, but discomfort that starts about 12 or 24 hours after the activity. So it's not immediate, for one, and it gets better with a little rest and time. Whereas a true injury, that tend to be more immediate. So, there's a collision or something happens, and the child is now complaining or limping, and there's bigger warning signs that a parent would see potentially. Things that kind of, tell you, hey, something doesn't seem right here. The reality is that as a parent, your kid better than anybody else. And if you notice, hey, something's kind of off, you got to trust your gut. With regard to concussions, I think the first thing to kind of cover are the various signs and symptoms that a parent or a coach may see. We kind of break those up broadly into 4 different types. So the first one would be physical, the second one would be something like cognitive, then we would describe them as emotional, and finally as sleep related. So going through the different groups. So your physical symptoms you're going to see are things like headache, nausea or vomiting, kids or the patient complaining of irritability with light or loud noises, or even balance issues. With regard to the cognitive signs and symptoms that we would see, these are perhaps far more difficult to recognize from an outsider's perspective, because it requires a patient to recognize it. But things like forgetfulness, or this mental fog, if you will, that people often describe, can also kind of have difficulty concentrating. As far as the emotional symptoms that exist, so we tend to see that some of the kids perhaps are a little more emotional than usual, whether it be anxiety or sadness, just a little more irritable, so to speak. And then as far as the sleep-related symptoms, we would describe those as difficulty falling asleep, or even abnormal sleeping patterns, so sleeping a lot or not sleeping at all. It's hard to pinpoint exactly when it started. I think certainly over the last decade, we've seen a major rise in youth sports and leagues, particularly in North Texas and the Metroplex. And so, kind of correlated it with that time period. Really the long-term ramifications are that if, there's a, sports-related repetitive injury pattern and it goes unrecognized, a small injury progresses and worsens over time, and ultimately can affect, how long a young player can potentially play a sport. If, hypothetically, let's say they have like a small, tear like in a ligament, and something that can potentially resolve with just a little rest and recognition and time, and we keep playing on it, we keep going out there and trying to push through it, and we take something that's a small problem and create a much larger problem that eventually is not going to resolve on its own, and it's going to require some sort of intervention. So as a parent myself, the biggest advice I think I would give any parent out there is trust your gut. Like, parents know their kids better than anyone else. And if something feels off, question your child and then talk to them. The reality is a lot of these kids, they're competitive by nature, and then you add like the expectations that come with playing either for the school or club, and the coaches and the parents, cheering them on. It's a feeling that we all like, right? Like being on the field and, having your moment in the spotlight, so to speak. And so they don't want to miss any playing time. They don't want to step off the field. And so a lot of times the kids will, try to hide it or minimize it to not lose any playing time. And so I think just having that open dialogue with your kid and knowing and making sure that they understand that, hey, it's okay. Like if you're hurt or you're injured, like it's going to get worse if we ignore this. Let's take a second and rest if we need to. It's okay to miss a practice. It's okay to miss a game. Because if we don't and we try to push through these things, oftentimes, again, if the injury worsens, it eventually may turn into something that's potentially career-ending, or at least is going to put them on the sideline for a lot longer than they want to be. Speaking from personal experience, I, as a young man, like played football for my school, and definitely back in those days, traumatic head injuries and concussions were not as well recognized as they are today. And I can think of multiple instances where, in hindsight now, knowing what I know, like one of my teammates, had an obvious concussion and was told to walk it off and get back in the game. The team needed them, and ultimately that led to them hitting their head again, and now they were out for weeks because it was so apparent down that it could not be ignored. So it's probably the easiest one or quickest one that comes to mind just from personal experience. Going to be dependent on whether the patient is being brought in by private vehicle or their family, or coming in via EMS. Typically, if the trauma team is involved, particularly early on, then it's a patient or a child that's arriving via EMS because they've called ahead. We have great relationships with our EMS partners. We actually help in establishing their protocols for them and for our hospital, and we'll have different levels of trauma activation, so to speak, meaning what resources are going to be available the second the patient hits the door. And so if our EMS partners call us and tell us, let's say hypothetically that, something from like the last couple of years, patient is playing in a football game, took a pretty big blow to the head, and is now complaining that they can't move their arms or legs. So that patient is, someone is called EMS, someone's called 911. They call ahead, they tell us what's coming in, and so we are actively preparing to receive that patient and kind of thinking ahead of what could this possibly entail. And in a situation like that, we're very worried about like a spinal cord injury of some sort, and so we would, at our facility, activate this. We would have the CT scanners on standby for this patient. So we actually have the luxury of having multiple scanners in our facility. So we would put one and designate it, hey, this is going to be for our trauma patient when they arrive, so that the second the patient hits our door, we can do a quick physical exam and assessment, and then get them over for more advanced radiographic studies to help us diagnose the problem in a very expedited fashion. So one is your highest level trauma center. Our facility is currently a 2, and we actually plan on pursuing level 1 here in the very near future. The biggest difference between what we do now and what we'll offer as a level 1 is really, or between any 2 and 1, I should say, is really residence and research. Residents imply that there's a graduate medical education program associated with the facility, and that's basically trainees. Interestingly enough, there's this common misconception that if you go to a center that has trainees, the care may not be as good as if you go to a hospital that only has attending doctors. But there's actually been a ton of literature done on the subject, and what has been found is that the centers that have trainees actually provide significantly better level of care than facilities that don't have residents. And when we take a step back and think about it, it makes sense because, the people that are working at these facilities and are engaging with the medical students and the residents, they really have to be up to date on the most contemporary literature and research, because you have all these young minds around you at all times that are questioning every single thing you do. And so, if there's a provider that's practicing outdated medicine at these centers, they're kind of quickly found out, and the med students and residents are talking, well, Dr. XYZ, he doesn't really do things by the book, and then they start talking about their complications, et cetera. And so, interestingly enough, it is the academic centers or GME centers that actually provide higher level of care. The other key difference between a 1 and 2 would be the research component. So the difference between a level 2 and a level 3 trauma center is going to be primarily resources. So for instance, a level 3 trauma center may or may not have an association with either a neurosurgeon or an orthopedic surgeon. They'll certainly have a general surgeon on call. That general surgeon may or may not be trauma critical care trained. At our facility, almost all of our surgeons that are on the trauma service are trauma critical care trained physicians, which means they've done a fellowship and specialize in trauma and critical care. For anyone that doesn't know what that means, it basically means that if they come into our facility and they end up in ICU, we're managing them because we're ICU doctors as well, surgeons. Additionally is the availability of that. So at our facility, there is a trauma surgeon in-house 24/7. So that means if anyone comes in and they're seriously injured, the trauma team responds within seconds. The majority of the time, frankly, I'm very proud to say, because this is something that we monitor, that our response to the highest level activations within 15 minutes is 100%. So if we ever have a surgeon that shows up late, well, they're going to get a phone call from me because we're batting 1,000. We don't want to change that. So, but that's simply because we're in-house. We're there, we're ready, we're prepared, and awaiting the arrival of our patients. Well, I think the most common thing we see by far, and this isn't exclusive to our trauma centers, just every trauma center in this country, is old person that fell down and hurt themselves. Gravity is undefeated. It wins every single time. So gravity's a constant, and the reality is that our general population has gotten older because people are living longer. And so as our population ages, particularly the baby boomer group, which is such a large portion of our population, there's more grandma or grandpa fell down and either broke their hip or hit their head, and they had medical problems to begin with, so sometimes they're on blood thinners. If they hit their head, they could have a head bleed. So there's that's by far the largest segment that we see, and again, that holds true for essentially every trauma center in this country. Probably MVCs. Motor vehicle collisions or accidents. So, everybody's driving. We don't have a robust, public transportation system here. Everybody's dependent on their vehicle. There's an intricate highway system in the area, and so we see a lot of people that lose control and, are in a car wreck of some sort.